Hello, this is Dr. Grande. Welcome to my video on cognitive distortions and irrational ideas. So in this video, we'll be taking a look at a couple different constructs from cognitive behavioral therapy and rational emotive behavioral therapy. The first construct we'll be looking at is Beckian cognitive distortions, and there's quite a few of those that I'll go over. And the next concept are irrational ideas or beliefs, as written about by Albert Ellis. So first, taking a look at cognitive distortions. Now, this is one of these concepts that I feel in cognitive therapy is not very well understood. It tends to be, I think, sometimes overlooked or explained briefly, but it's actually a cornerstone of CBT. Cognitive distortions are consistent errors in thinking. And you see I have that in red. That's a very important definition. Consistent errors in thinking. Cognitive distortions don't necessarily tie to core beliefs or intermediate beliefs directly, although there's some overlap clearly between consistent errors in thinking and intermediate beliefs that aren't helpful and core beliefs that aren't helpful. But cognitive distortions are a separate and distinct construct. They're errors in thinking that a client who is suffering from symptoms consistently makes. So typically, if you have a client suffering from depression or anxiety, you will find several of these cognitive distortions apply in varying degrees to an individual like that. So let's take a look at the cognitive distortions, and then we'll take a look at the irrational ideas or beliefs. So the first cognitive distortion is all or nothing thinking, also known as black and white thinking, polarized thinking, or dichotomous thinking. So this is when a client views a situation as belonging to one of two categories instead of resting somewhere on a continuum. So say you have a client who is worried about her skills as a mother. So she had all or nothing thinking. One possible way you could see that distortion in action would be if she kind of viewed herself as either a perfect mother or a terrible mother, but really didn't leave any room in between. So couldn't accept that it's, sometimes she's effective at being a mother, and sometimes she's less effective, which is a more useful way to think about it. Whereas a riskier way, a way that leads to more symptoms, is the dichotomous thinking. The next distortion is catastrophizing. And this is a particularly popular cognitive distortion, also known as fortune telling. This is where a client predicts events in the future will turn out negatively without considering more likely outcomes that would probably be more positive. So really, catastrophizing is about predicting the future. Right? This is particularly common in working with clients who have depression and anxiety as well as other symptoms. They'll look at the future and they'll look at the wide range of alternatives, and they really tend to focus on what the worst possible outcome could be. The next cognitive distortion is disqualifying or discounting the positive. And we can see this with a wide range of symptoms, but typically this one I see with individuals who are depressed or have depressive-like symptoms. So just like the majority of clients, right, some actions that they participate in are very good and very helpful, and some are less than helpful. Matter of fact, that's that goes for clients or just about anybody. Typically, people who are depressed will not count the positive experiences. They'll disqualify them. So an example would be, say a client is a student and they have a particular semester, maybe they're taking 5 courses and they have 3 A's and 1 B and then 1 C, right? So clearly the C, that leaves some room for improvement, but the 3 A's and 1 B, those are positive. A client who's depressed in that situation might just not even want to discuss those 3 A's and the B and just really focus on the C, not giving themselves any credit for the good grades, just completely discounting the good grades. And usually through some sort of process where they acknowledge the grades are good, but have reasons why they shouldn't get credit for them. Like, those are easy courses, or that's something that I should have known. That subject matter is something I should have known because of course I would do well. But the course that I really want to do well in is the one in which I was graded a C, and that's why I'm upset, or that's making me upset. It's one of the reasons. The next distortion is emotional reasoning. So this is where a client believes something is true because they feel it so strongly. So they're really, in this case, kind of running with the feeling. Again, they're ignoring or discounting any evidence that doesn't support that conclusion, right? There's going to be evidence that doesn't support that conclusion, but they're not going to focus on that. They're going to look at how they feel. And what's interesting here is that's the way it's described, right? That something must be true because they feel, but really it's because they believe. So whenever you see emotional reasoning, this gives you a good opportunity to explain the difference between feeling and believing. Because with emotional reasoning, there's really a belief, a strong belief at work that the client is interpreting as a feeling. The next distortion is labeling. So labeling is where an individual assigns a label to themselves, others, or a situation. This label is rigid and global, and they don't consider evidence that might be more reasonable. So again, you can see a pattern here with a lot of these cognitive distortions is an unwillingness or inability to weigh evidence that would be positive or even be more likely to occur. So the danger with labeling, of course, is that this can become, once somebody, especially if they're labeling a person like themselves, like if they think of themselves as a loser, and they use that word loser, that becomes powerful in and of itself, just that label, just saying it. And typically, when you're treating a client who is labeling, you're going to hear that label many times. So that's going to be a term that's used over and over. Next distortion is magnification minimization. So this is when a client evaluates themselves or others or a situation in a manner where they unreasonably magnify the negative and or minimize positive aspects. This is also a relatively common cognitive distortion. And a lot of these are very similar to one another. This is similar to the discounting or disqualifying the positive. Matter of fact, the minimization component is really the same as that, except in the minimization, there's usually some acknowledgement of the positive. It's just minimized, whereas the disqualifying and discounting, I think it was different because it's just totally thrown out, right? So this distortion, the magnification minimization, works in two ways. It magnifies the negative, making it unreasonably large, right? And minimizes the positive, making it unreasonably small. Okay, so taking a look at some other cognitive distortions, the next one we have is the mental filter, also called selective abstraction. This is when a client pays a lot of attention, a disproportionate amount of attention, to one negative detail or a small set of negative details, instead of seeing the larger picture. And of course, in this example of cognitive distortion, we're presuming that the larger picture would include other positive details. All right, so this isn't, so the distinction I'm trying to make here is this isn't picking a few negative details out of a situation that's entirely negative. This is finding negative details in a situation that has some negativity potentially, but also a lot of positive elements. Again, this is similar to other cognitive distortions we looked at, going back to this other slide, the disqualifying or discounting the positive and the magnification minimization are similar to the mental filter in that the evaluation of negative and positive aspects are distorted. So oftentimes when working with clients, you may see the consistent error in thinking, you may see the cognitive distortion, and it may be clear to you that there is one, but you're really not sure which one it is. While it is important to identify the correct cognitive distortion, what's also important is using the correct techniques and being helpful to your client. So, the idea here is that you're detecting a pattern, and you're putting a label on it, not like the cognitive distortion labeling, but you're putting a label on it that you can use to be helpful in treatment planning and conducting the actual treatment. So it's important to have some comfort level with the overlap that exists between these cognitive distortions. The next cognitive distortion is called mind reading. And this is a particularly popular cognitive distortion, both with clients who have depression and anxiety. So this is where a client believes they know what others are thinking, and again, don't consider the more likely possibilities. Again, presuming that we're going to presume those possibilities, the more likely possibilities are positive. Sometimes we also see the mind reading when treating clients that are having difficulty with managing frustration or anger. Right? So an example could be a client comes into a mental health agency for treatment, and the first person they're greeted by is like an administrative assistant, somebody who checks them in for an appointment, say, for like an individual counseling appointment. And they might come to that counseling appointment, or it might be group therapy or whatever type of treatment it is, and indicate to the counselor that because the administrative assistant or the receptionist made them wait for a few minutes, took a phone call, made them wait for a few minutes, or didn't make a lot of eye contact, or maybe used an elevated tone or elevated volume in the voice, or a tone that they didn't think was particularly polite, they might believe that that administrative assistant doesn't like them, is out to get them, is not treating them fairly, when probably the more likely explanation for those different scenarios that I described, like for example the phone, the administrative assistant may have to answer the phone in so many rings, or with an elevated volume, might be because the room is loud, right? The reception area is loud. And with the example of minimal eye contact, it could be because the administrative assistant is scanning other things in their view that the client can't see, but that the administrative assistant is responsible for monitoring, right? Something on the computer, like email, or maybe what phone lines are active. So there's any number of explanations, but again, if a client is having this errant thinking, the mind reading cognitive distortion, they are going to jump to usually a negative conclusion, and they're going to fail to consider more positive or useful or realistic possibilities. The next cognitive distortion is overgeneralization, and this one is extremely popular. It's likely if you're going to be treating clients who have depression, anxiety, or again other symptoms like anger and frustration, you're going to see this cognitive distortion quite often. And this is where an individual makes broad negative conclusions that are far beyond what the situation indicates. Right, so an example could be, say you have a client and they're looking for work and they find a job, and on the first day that they go into their job, they interact with various people, like in orientation, whatever process they need to go through on the first day, and maybe they have an awkward conversation where they feel maybe a little judged or something like that, and they overgeneralize that, say, awkward conversation into, they're going to fail at this job because they don't have the necessary social skills to go through a day without an awkward social interaction, right? So they've taken something that could be real, meaning that there certainly could be an awkward social interaction when you're starting a new job, and there's a lot of people to meet, and you might forget people's names, and you're thinking about orientation, which you have to get done, and try to make a good impression. So it's certainly reasonable to think there might be some imperfect social interactions, but what's not reasonable, or what's not necessarily logical, is the broad negative conclusion that comes out of that, which is, I'm not going to succeed in this new position because of that one thing, right? So you'll see this, again, fairly often. This is one to be on the lookout for. And again, there is some overlap with some of the other cognitive distortions. So moving on, the next cognitive distortion is called personalization. Now, personalization is an interesting cognitive distortion because it's not remarkably similar to the others. Like I mentioned, mental filter, disqualifying the positive, magnification minimization, have these similarities. Personalization is different. Personalization is when a client believes that others are behaving negatively because of them. Again, without giving proper weight to more likely explanations for the other person's behavior. So, as the name of the cognitive distortion would suggest, the client is taking the other person's behavior personally, right? So, in the example of the first day at work, right? Say that as they were, being introduced to people in various offices, one of the people was very short with your client, right? When your client's starting work, and they're describing their first workday, and one of the people at the workplace, the only employees, very short, when they're being introduced. Instead of thinking, kind of the likely, looking for the likely explanations, like the person was busy, the person was thinking, I'll have time to get to know this person later on, they're getting ready to take a phone call or go to a meeting or rushed. Instead, somebody who is having cognitive distortion and personalization would say, it's something about me, right? Something negative about me that caused this person to behave that way. Right? So this, again, fairly easy to spot when you see personalization, and a good opportunity to challenge this, distorted thinking. So the next cognitive distortion, actually kind of a family of cognitive distortions, is the should and must statements, the imperatives. And I will talk more about these when we take a look at the slides in a few minutes on irrational ideas or beliefs, because this is a real focus of the work of Albert Ellis, although it is included in the work of Aaron Beck. So a should and must statement or imperative is where a client has a precise, fixed idea of how others should behave, and they overestimate how bad it is when these behavioral expectations are not met. So if a client says that people must treat me well, or people should treat me well, or should meet certain needs, these are imperatives. So look for these words, should and must. Look for these words. Again, this is a fairly easy cognitive distortion to spot, and if you are working with a client that has a lot of should and must statements that they're discussing at different points in therapy, consider taking a look at what we're going to cover here in a few minutes, which are the irrational ideas and beliefs, which are really pretty much just focus on imperatives. And then we have the last cognitive distortion I'm going to cover in this video. It's called tunnel vision. This is where a client only sees the negative aspects of a situation. Now again, this sounds a lot like mental filter, and that's where a client sees one or a few negative details instead of the larger situation. Tunnel vision is very similar to mental filter, except I typically view tunnel vision used more in a general sense. So this is where instead of a particular specific situation that can be described concretely, like a mental filter, there's one or a very few details. This is an error where a client tends to always see the negative aspects of all kinds of situations. So let's take a look now at the irrational ideas or rational beliefs as written about by Albert Ellis, although I have a few that I've put in here myself from my experience. So these are the irrational ideas, right? So these are not the same as cognitive distortions, but there is overlap between them. So I like to think of the irrational ideas or beliefs in one sense kind of like the cognitive distortion, the should-must cognitive distortion family, right? The imperatives. But in another sense, the irrational ideas are a lot like the core beliefs and intermediate beliefs from the Beckian cognitive model. And it really depends on the particular irrational idea and the particular situation as to how you categorize any particular one of these. Do you consider it an intermediate belief, which is a rule, attitude, or assumption that a client has, or a core belief, right, a deeply held belief? Do you think of it more like a cognitive distortion? It's very dependent on the client, the symptoms, the situation, the context. So let's take a look at the irrational ideas. So the first one is, I absolutely must have sincere love and approval almost all the time from all of the significant people in my life. All right, so again, the word must is in there, and the word absolutely is in there. So a couple clues that this is going to be an imperative or an irrational idea. The next one, I must be thoroughly competent, adequate, and achieving in all respects. Otherwise, I'm worthless. Right? So this kind of sounds like a few of the cognitive distortions. So some of the, kind of like the dichotomous thinking, for example. They must be thoroughly competent or they're worthless. Right? So it's one or the other. The next one is, people who harm me or do bad things to me are uniformly bad or awful and should be blamed and punished for what they've done. Right? So again, you can see how this particular idea, now the way Albert Ellis discussed these, he labeled them irrational, right? Where Aaron Beck would probably say more something like dysfunctional or less than useful. But you can see how either way, this isn't a helpful way of thinking and can lead to a wide variety of problems. Next irrational idea is, when things do not go my way, life is terrible, horrible, or catastrophic. Whereas I have here, awful, right? Again, you can see destructive elements in there in terms of destructive meaning leading to symptoms that could arise from an individual having that particular irrational idea. The next rational idea I have here is, life should be fair, but it is not, so I cannot succeed. This is one I've seen many times in my years of treating clients. There's a kind of an irrational idea that life should be fair, but an acknowledgement that it's not fair, therefore it kind of puts up a blockade, so in the client's thinking, they can't succeed. So without life being fair, there's no success. And of course, life will never be fair. So as long as they maintain that irrational idea, you're going to have trouble helping them succeed. Right? So that's an obstacle. Right? All these irrational ideas, in fact, are obstacles. The next one is, unhappiness is caused by external events. Furthermore, those external events are not under the control of the client, or maybe just a little bit of control. Additionally, the clients have a little ability to control their feelings or rid themselves of negative feelings. So this is kind of external locus of control. This is where, or when a client believes that their satisfaction, their happiness in life is really controlled by external events and not internally. And here's the thing, there's a degree of truth to that, right? I mean, happiness or unhappiness, I guess either way you could argue it, is caused by internal and external events both. However, when somebody thinks of either happiness or unhappiness as only being caused by external events, that makes them very susceptible to negative affect. Because if things are going well, they may be happy. If things are not going well, externally this is, they may not be happy. So it's very hard to find stability when a client hangs on to this particular irrational belief. The next irrational idea is, good people do good things and bad people do bad things. This is one I've seen many, many times, and this is kind of this is a rigid way of thinking, similar to dichotomous thinking, where it's difficult for clients to understand how somebody that they have labeled good could do something bad, and how somebody they label bad can do something good. So this is an inflexibility in thinking that is irrational, and it can lead to the client putting certain people on pedestals when they shouldn't be, and it can lead to the client discarding people because of one or a small series of negative things that person's done. And oftentimes, when I see this particular irrational idea, that if they say the client's depressed, they're going to think of themselves as a bad person. So therefore, it kind of makes sense, for them to do bad things. But again, if they do good things, they tend to not label themselves as good, right? Even though the irrational idea here is good people do good things. So there's really, again, it kind of, this one pulls back to like the cognitive distortions, where it's a inaccurate evaluation of evidence. The next one is, I must avoid disapproval from any source. Right? Very straightforward. So in this situation, a client is going to avoid situations where disapproval is a possibility, and of course this is going to mean avoiding a large number of situations. This is just, kind of like avoiding pain, because when clients have this irrational idea, oftentimes disapproval is causing pain. Right? So we need to understand that when treating clients. The next one is, because I failed to accomplish goals in the past, I should give up trying to do them or to achieve them in the future. This is an irrational idea that I've seen a lot, and it can also be kind of tied in with development. So depending on how old a client is, or how old they consider themselves, relative to different tasks they need to accomplish, they may look at a situation and have this idea that I failed to get, I failed to get a stable relationship in the past, right? So I need to stop trying to get a stable relationship in the future. It's never going to happen, right? Or I failed to get meaningful employment in the past, or hold on to it. So therefore, I'm going to give up. So if they consider themselves, because of their chronological age or their stage of development, or for whatever reason, if they consider themselves at a point in their life where there's not much good that can come because they've wasted so much time, that's what they're going to look at. Like, it's taken me 30 years, I still have a stable relationship. What's the point of trying to do it if I'm only, going to have another 10 or 20 years to potentially enjoy a relationship, right? It's almost becomes a mathematical argument, but you can see it at any stage of development, even in clients who are relatively young. If they fail to accomplish goals, say like educational goals, they might say, well, I didn't do so well in a few classes or in several classes in college, so there's really no sense in trying to go back to college. So it's not necessarily tied to believing that the best parts of or the best opportunities in their life are behind them, although that is a common place where you'll see this particular irrational idea. Okay, so the remaining irrational ideas starts with things must be the way I want them to be, right? So a very clear must statement there. I must worry about things that could be dangerous, unpleasant, or frightening, because if I don't, they might happen, right? So again, you can really see this is one of the more clear irrational ideas in terms of the word irrational, right? If this is where a client believes if they don't worry about something, then that increases the probability that it might happen. So this is one that is very consistent with the kind of somewhat direct and confrontational style of REBT. And you can go right after this one and challenge it rationally. The next one is, I must avoid life's difficulties, unpleasantness, and responsibilities. And again, usually this is because it's painful, right? And that connects to the I shouldn't have to feel discomfort or pain distortion that I'll get to in a few minutes. The next distortion, everyone needs to depend on someone stronger than themselves. It's kind of a dependent way of thinking. Again, this also kind of ties to the external locus of control. So a client who has this irrational belief or idea, they may be okay if they have someone to depend on that they view as stronger than themselves, but when that person is not available for a short period of time or an extended period of time, or if it turns out that they're never available again, like they, like a divorce, or if they pass away, this belief can become very destructive. The next irrational idea is, events in my past are the cause of my current problems, and they continue to influence my feelings and my behaviors in the present, right? So events in my past, or you could also add to that interactions with family members in the past, because that's oftentimes what you'll see here in this particular irrational idea. So this is, again, this is one of those irrational thoughts, rational beliefs rather, that individual who believes this really avoids taking responsibility to work with you to overcome problems, because they're viewing these problems as caused in the past and still influencing them today. So they're, if events in the past cause your problems, it's hard, if you think of it that way, it's hard to see and take ownership and responsibility to work through the problems. Right? So this one can be a little tricky. The idea here is you've got to challenge that the problem can't be solved. I do agree that events in a person's past, particularly interactions with family members, can be the cause of current problems. That in itself is not necessarily irrational. That they must continue to influence feelings and behaviors now, right, if that's in fact what the client believes, that this can certainly be challenged. And, events in the past aren't responsible for all problems, so that can be challenged as well. The next irrational idea is, I should become upset when other people have problems, and furthermore, feel unhappy when they feel unhappy. So this is kind of the opposite of someone saying I should celebrate when somebody else is happy, right? Which we usually consider a positive or rational idea. This is beyond sympathy, right? I mean, between friends, sympathy is to an extent a positive trait, right? Or a positive state, rather. But this is more destructive, because this is actually a rational idea that is held and repeated over and over in every situation. So again, making the client vulnerable based on the moods of other people. So I spoke briefly about this one earlier. I shouldn't have to feel discomfort and pain. This irrational belief is again tricky, because in life there is going to be discomfort and pain, right? Your client, all your clients, you yourself, right? Everyone you know will feel discomfort and pain. It's the I shouldn't have to feel part that becomes an obstacle to overcoming symptoms. So this, the one objective here could be, depending on a client, an acceptance that there will be some level of discomfort and pain. Matter of fact, that is a part of REBT, getting better at tolerating frustration. Another irrational belief: every problem should have an ideal solution. And of course we know that every problem does not necessarily have an ideal solution, or else, or rather, it's not always easy to identify that ideal solution. And the last irrational idea here: avoiding responsibility or challenges is easier than facing them. Right, so this is an avoidance, kind of like the I shouldn't have to feel discomfort and pain. So clients who have this thought will try to dodge tough situations rather than heading toward the problem and looking for solutions and working through and doing the hard work of therapy. Right, so counseling is difficult, right, from the counselor's point of view and from the client's point of view. And I sometimes think of this irrational idea as being fairly common. I've seen it as fairly common when clients are facing problems with alcohol use or other substances. Right? It is easier in the short run for many to avoid trying to stop drinking or using drugs. In the very short run, that may be easier. Of course, as we know, in the long run, it's quite difficult and will lead to other problems. Although this irrational idea is not exclusive to alcohol use or drug use. It could also be, the client is weighing the challenges of getting into an educational program or getting into a job, or putting in work to repair a relationship that isn't going well. So there's a lot of opportunities where avoiding responsibility or challenges appears easier than not avoiding them. So that concludes my review of cognitive distortions and irrational ideas. As always, if you have any questions or concerns, feel free to contact me and I'll be happy to assist you.